When you hear the word androgens, you get a little cross-eyed, a little confused, like what the hell are we talking about? And I don't blame you because I feel like there's a lot of discussion around estrogen and progesterone, but not much around the word androgens. But here's the unfortunate news. Whether you are a teenager or whether you are somebody in your 50s and 60s, androgens are affecting us all. And there are a couple of different reasons for it, and we're going to break it down in just a minute. But androgens, let's define it first, are those derivatives of hormones that work in different ways. So testosterone is an androgen, but the breakdown products of testosterone, which include DHT and free testosterone, are androgenic, as is androstenedione. These will often cause symptoms that we often associate with androgens, including acne, oily skin, a lot of irritability, a lot of scalp hair loss, but facial or body hair. Those are your very common high androgen symptoms. Now, what's happening with high androgens is that it's impacting all the other hormones as well. And it's very related to cortisol and insulin and blood sugar. So in addition to the symptoms I just mentioned, androgen issues or androgen elevation can also cause infertility and irregular cycles. So many young girls today get put on the birth control pill immediately because they're having irregular cycles, when the root of that issue is in this conversation around androgens. A big diagnosis with high androgens is PCOS or polycystic ovarian syndrome, but it's not the only diagnosis associated with androgens. Did you actually know that there's an androgen positive breast cancer? We're not testing for androgens routinely. We need to be able to put this whole hormone puzzle together. So when you're going into your doctor and trying to figure out if you have an androgen issue, you've checked off all the symptoms that I've just mentioned, then what you need to be checking are just those: DHEAS, a DHT, a total and free testosterone, 17-hydroxyprogesterone, and AMH. And that's your androgen checklist to track and measure in lab work, whether that lab work is going to be blood work through LabCorp Request, or whether it's going to be a saliva hormone test. All right, so that's kind of what androgens are and what they do, but why? Why do we have an epidemic of androgen dominance right now? And there are a couple of different reasons why. I feel like the environment is a big part of this, because with increased exposure to environmental toxins, the liver can't do its work to get the body rid of dirty hormones or hormone metabolites like the androgens. In addition to that, a climate of chronic stress and cortisol, higher cortisol levels, triggers sort of this buzzing first in the brain that then disrupts the hormone profile. In turn, high cortisol being linked to high androgens, and that in turn being linked to high blood sugar and high insulin and blocking ovulation at the end of the day. So high androgens, high cortisol, high insulin all go together. And of course, there's probably a genetic link to all of these things. For example, in Southeast Asia, we know almost 70% of women have PCOS or polycystic ovarian syndrome, where they need something to block their androgens. So again, this is a big issue. I think it's an evolving issue. I think it's increasing, and I actually think it's underdiagnosed as well. Now, in the context of hormone shifts, we talked about, the earliest hormone shift, which is in puberty and those teenage years. But as we go through the different decades and our hormones continue to shift, those of us with a tendency towards androgen dominance can see re-expression of that, whether it's in perimenopause, menopause, after childbirth, or even after breastfeeding. And you'll know it. Each of us know it in different ways. Some of us get like the oily hair, the oily scalp. Some people get the acne, which is usually localized to the jawline or on the chin or even on the back. Others gain weight, so they start to get the belly fat. But each of us presents with our androgen symptoms in different ways. It's important for you to be tracking and paying attention to your body so you know what's going on. But how do we reverse androgen dominance? What can we do about it? Well, it needs a holistic approach and needs a multi-pronged approach to tackle all the different areas where these androgens are being allowed to overexpress themselves. And this time, let's actually start up here in the brain. We want to turn that faucet of cortisol off. And to do that, we need to have a cortisol management plan. That can look like 20 minutes of guided imagery or meditation in the morning and then at night. It can look like tapping through the key energy centers of the face and then the upper neck. It can look simply like rotating your fingers right here in this pineal gland area and massaging it. If you want to take it up a notch, then maybe even adding some hot oil right here and massaging that gently, or even oiling your scalp at night and sleeping. It's a way to calm the nervous system down. Appointments like acupuncture, massage, yoga, all of these also help to bring that cortisol level down and indirectly help to reduce that androgen dominance. Now, stress and stress management is one part of a strategy around bringing androgens down. Another one is diet. Really paying attention to both diet and to sleep. Deep, consistent sleep is essential to lowering androgens. My androgen dominance expressed itself when I started doing ER work and flipping my nights and days and nights all over the place. I want you instead to be thinking about, are you falling asleep at the same time and waking up at the same time every night and getting at least 90 minutes of deep sleep and 90 minutes of REM sleep? We know that in turn will allow the body to go into a restful state, bring that cortisol level down, and indirectly bring those androgens down as well. Now, with this toxic load, the quality of your diet becomes really important. So getting rid of processed foods, foods with a lot of chemicals and dyes, sodas and fast foods, it's something, I'm working with my own teenagers on. All of those things are triggering androgen dominance. So pay attention to the quality of your food. How clean is it? Get rid of excessive amounts of sugar and processed carbohydrates. They make androgen dominance worse. And in a big population of androgen dominance, many of them, I would venture to say almost 75% of them, have an issue with either gluten or candida, which is an overgrowth of yeast in the gut. That's some of what you need to be thinking about when it comes to the diet component of androgen dominance. All right, let's tackle one more. What can you take? And yes, there are herbs and supplements, and there are medications to help you with androgen dominance. The first category of herbs and supplements really goes into the cortisol balancers, the adaptogens, for example. So these are going to be things like holy basil, theanine, which helps to regulate anxiety, maca, or even ashwagandha. The next category goes into targeting those androgens directly, right? Saw palmetto is one that we like, and we like inositol and berberine because it manages the blood sugar component of androgen dominance as well. So that's some of what you can add into your regimen to help you with the androgens. Last but certainly not least are things like saw palmetto, an herb that targets those androgens head on. We also know that green tea seems to play a role, as does spearmint tea, all anti-androgens. And then there's the medication toolbox, from spironolactone to oral minoxidil to topical spironolactone, something called Winlevi. There are many different remedies to help bring androgens down, both externally and internally, to help you really fight and beat a lot of these different symptoms. So from cortisol management and stress management to sleep, to your diet, to in turn thinking about herbs and supplements, and then of course medication, remember, identify your hormone pattern first, understand if it's androgen dominance that you're dealing with, build this treatment plan, but don't reach for a birth control pill as your only option to balancing hormones. Then you go for years masking this issue with androgens and not really getting to the root, which in turn creates and sort of facilitates a whole other host of health issues. All right, I hope this made sense out of the whole world of androgens and this evolving world of androgen dominance that I feel like we are all living in currently. Remember, I post new videos every week. Don't forget to like and subscribe.